The pursuit of a vaccine to combat both oral and genital herpes has been a long-standing endeavour within the realm of medical research, stretching back nearly a century to the early 1930s. This pursuit has been fueled by the recognition of the significant public health burden posed by herpes simplex virus, HSV, particularly types 1 and 2. HSV infections are highly prevalent worldwide, with an estimated 3.7 billion people under the age of 50 infected with HSV1 and 417 million with HSV2. These infections not only cause discomfort and stigma, but also contribute to a range of complications, including neonatal herpes, increased susceptibility to HIV infection, and psychological distress. Over this extensive period, scientists and researchers have dedicated considerable resources and expertise to the development of a vaccine capable of effectively combating HSV1 and HSV2. Despite these efforts, however, the journey towards a successful vaccine has been marked by numerous challenges and setbacks. These challenges stem from the complex nature of the herpes virus, its ability to establish lifelong infections, and the elusive nature of durable immune responses against it. Herpes simplex virus, notably HSV1 and HSV2, present significant hurdles due to their unique ability to establish lifelong infections within the human body. These infections can manifest as recurrent outbreaks characterized by the appearance of painful sores or blisters on the skin or mucous membranes. Recurrent outbreaks not only cause physical discomfort but also psychological distress and can significantly impact the quality of life of affected individuals. Over the years, a multitude of vaccine candidates have been explored, ranging from traditional approaches such as inactivated or live attenuated vaccines to cutting-edge methodologies like genetic editing and subunit vaccines. Traditional vaccines approaches aim to stimulate the immune system to recognize and eliminate the virus upon exposure, while newer approaches leverage advancements in molecular biology and immunology to target specific components of the virus more effectively. However, the road to success has proven elusive, with most candidates exhibiting limited efficacy in human trials despite initial promise. Challenges in vaccine development, including the ability of the virus to evade immune detection, the establishment of latent infections in sensory neurons, and the variability of viral strains. Additionally, the lack of suitable animal models that accurately replicate humans' HSV infection poses a significant hurdle in preclinical vaccine testing. Recent advancements in vaccine development have introduced innovative approaches such as the application of genetic editing techniques like CRISPR-Cas9. These techniques, while still in the early stages of experimentation, offer a glimmer of hope for a breakthrough in herpes vaccine development. CRISPR-Cas9 technology allows for precise modification of the viral genome, potentially enabling the development of attenuated or replication defective vaccine strains that elicit robust immune responses without causing disease. However, significant challenges remain, necessitating further research and refinement of existing methodologies. These challenges include optimizing vaccine delivery methods, improving vaccine immunogenicity and durability, and addressing concerns related to vaccine safety and long-term efficacy. Additionally, the global nature of herpes infections necessitates the development of vaccines that are accessible, affordable, and suitable for diverse populations, including those in resource-limited settings. While technically herpes vaccines do exist, they primarily target the varicella zoster virus (VZV), responsible for causing chickenpox and shingles, rather than HSV1 or HSV2. The available vaccines aim to prevent initial VZV infection, chickenpox vaccine, or reactivation of the virus in later life, shingles vaccine. Despite their efficacy in addressing VZV-related illnesses, these vaccines do not provide protection against oral or genital herpes infections, highlighting the need for dedicated research in this area. The development of VZV vaccines has provided valuable insights into the immunology of herpes virus infections and has paved the way for advancements in vaccine technology. However, the differences in pathogenesis and immune evasion strategies between VZV and HSV pose unique challenges in the development of herpes-specific vaccines. Efforts are underway to leverage the knowledge gained from VZV vaccine development to inform the design and evaluation of HSV vaccines. The World Health Organization has outlined clear priorities for the development of herpes vaccines, emphasizing the importance of reducing the incidence of HSV-related complications. These complications include an increased susceptibility to human immunodeficiency virus (HIV) and neonatal herpes, both of which pose significant public health challenges. To address these priorities, both prophylactic and therapeutic vaccines are deemed essential, offering potential solutions to the global burden of herpes infections and their associated health risks. Prophylactic vaccines aim to prevent primary HSV infections or reduce the frequency and severity of recurrent outbreaks, thereby reducing the risk of transmission to sexual partners and neonates. Therapeutic vaccines, on the other hand, aim to boost the immune response in individuals already infected with HSV, potentially reducing the frequency and severity in recurrent outbreaks and lowering the risk of complications such as neonatal herpes and HIV acquisition. Despite ongoing research efforts, numerous barriers impede the development of effective herpes vaccine. These barriers include the lack of suitable animal models that accurately replicate HIV infections in humans, limited study populations, challenges in assessing vaccine efficacy due to asymptomatic infections, and the complexity of evaluating viral shedding and transmission risks. Overcoming these obstacles requires interdisciplinary collaboration and innovative approaches to vaccine design and evaluation. Furthermore, the high degree of variability and genetic diversity among HSV strains complicates vaccine development efforts. The ability of the virus to undergo frequent reactivation and establish latent infections in sensory neurons further complicates the development of vaccines capable of eliciting durable immune responses. Additionally, concerns related to vaccine safety, including the potential for vaccine-induced enhancement or of infection or autoimmune reactions, must be carefully addressed through rigorous preclinical and clinical testing. Despite the challenges, recent studies have yielded encouraging breakthroughs, providing new insights and potential avenues for herpes vaccine development. For example, genetically modified forms of HSV1 have demonstrated promising results in preventing symptoms of HSV2 in animal models, suggesting a more robust immune response compared to previous vaccine candidates. Additionally, innovative techniques such as laser stimulation of immune cells have shown effectiveness in enhancing vaccine efficacy in experimental settings, hinting at exciting possibilities for future research directions. Other promising approaches include the use of virus-like particles (VLPs) and adjuvants to enhance vaccine immunogenicity, as well as the development of novel delivery systems such as nanoparticles and microneedle patches. These advancements highlight the potential for a multi-pronged approach to herpes vaccine development, combining cutting-edge technologies with a deeper understanding of viral pathogenesis and host immune responses. In conclusion, while significant challenges persist in the quest for a herpes vaccine, ongoing research efforts and recent advancements provide renewed optimism for eventual success. The development of an effective vaccine against oral and genital herpes would have profound implications for global public health, alleviating the burden of disease and associated complications while offering hope for a future free from the threat of herpes infections. Moving forward, continued investments in research, collaboration, and innovation will be crucial in realizing this ambitious goal. Moreover, efforts to address the social stigma associated with herpes infections and promote education and awareness about prevention and treatment options are essential for achieving meaningful progress in the fight against herpes.